Good evening, everyone. Finally, we got on. I can't believe technicalities are our wonderful thing here. Hey, everybody, my name is Paul, and we don't have Bev today because we have the most ominous Eileen Webster.
Eileen the Jinx.
Eileen the Jinx, obviously. It has nothing to do with Suzanne Schlacks, and who's going to be our presenter today. Hi, Suzanne.
Thank you, Suzanne. Thank you so much for joining us. So, Suzanne is a physician's assistant, and since graduating in 2010, she's been passionate about helping people, and she's been passionate for far longer than that about helping people. And actually, in the last decade of practice, and for actually over 2 years of which has been dedicated specifically to gastroenterology, she's been seeing her share of patients suffering from the heartache of heartburn. I love that joke.
That's right.
Yeah, so we're going to have Suzanne give us her little spiel. But first, while you're listening to her, you can download the workbook. We're going to teach you how to address GERD and hiatal hernia. You can download the workbook at justtouch.com/workbook. That's the first point of business. Also, if you're here for continuing ed credits, just put your name in the comment section. And then also, if you have any questions for Suzanne while she's talking, just type in the question and we'll pass that on to her. She does have a little PowerPoint, but we don't have to show it, but we're going to send it in an email afterwards, but she will give you the jokes that were in the PowerPoint. So
I'll try.
All right, Suzanne, you're on your own. Take it away.
Okay. All right. So to start off, I think the best way to understand when something's gone wrong is to understand what is supposed to happen when things are working correctly. So the digestive tract, just a little bit of basics. It's this long tube from mouth to anus, essentially, that magically converts the food and the beverages that we eat and drink into the things that we need to live. It's pretty amazing, actually. The things like carbohydrates, lipids and fats, proteins, nucleic acid, even the water that we need for hydration, all comes into us through the digestive tract. Our focus for GERD is going to be the top half. So basically the esophagus and the stomach. So I'm just going to talk briefly about what those really do and are. The esophagus is the long tube that transmits the food when you swallow. From here, squeezes in a very, the muscle squeeze in a certain pattern so that it pushes the food down into the stomach. And above the stomach, you have something called the lower esophageal sphincter, which is a super important muscle, and that has a lot to do with what happens when someone has GERD. So this lower esophageal sphincter, and a sphincter, if you're not familiar with that word, is a muscular tube or a muscular ring that tightens and relaxes. Some of the sphincters in our body we have control over, like the anal sphincter we're all familiar with. But this particular sphincter, we don't have control over. It's controlled by something that's automatic. So when you swallow it, squeeze, 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 this lower esophageal sphincter is closed until it feels the pressure of the food, or certain other triggers will cause it to open. The food can pass through and it goes into the stomach. So that's the basics of the esophagus. That's how it's supposed to work. And this sphincter stays closed until it needs to be open. The stomach, we're all familiar with what it is, but it's more specifically, it's a J-shaped tank. It holds the food so that it can begin the initial stages of digestion. And it too is sort of capped on either end with sphincters. So the sphincter, the lower esophageal sphincter, is the one that is sort of where the esophagus meets the stomach. And then on the other end of the stomach, after the food's been sitting in there and digesting, it goes into the small intestine through what's called the pyloric sphincter. So again, these are muscles that we have no control over. So inside the stomach is sort of this hostile environment, right? And it's filled with gastric juices, which are made up of very harsh chemicals like hydrochloric acid, digestive enzymes, some water, some salt, some extra, stuff that you don't have to worry about. But basically, it's things that are caustic. Okay, so, and we need that. We need that acid because it helps to kill germs. It helps to break down the food from big bulky pieces to a thin liquid that can pass on into the small intestine. It's also beginning the stages of digestion so that things can get broken down into such small parts that they can be absorbed and then we can use them. The stomach is also importantly, sometimes the question might be, well, then why doesn't the stomach digest itself? So the stomach has a protective layer. It's covered with a mucus called mucin that helps to protect the lining of the stomach. And it also has buffering agents. So it has things that they keep the acid level low enough to do its job, but not get too low so that you start having injury. And why I bring this up, why it's important, is that the stomach has, all these protective mechanisms, but the esophagus does not. The esophagus is more of if you imagine you're wearing a hot pad on your hand to take something out of the oven. The esophagus is kind of like your wrist. If you use the pad, you're protected, but if it hits your wrist, you're going to get burned. So the main function of this lower esophageal sphincter, and I'm just going to call it the LES helps to keep the stomach acid inside the stomach. So it helps to protect the esophagus. And again, it does have to open, because if it gets stuck closed, that's a whole other problem. But it opens when food goes down, and it sometimes will open if there's like a lot of air in the stomach. It can open, and that's what belching is. But it's really supposed to stay closed unless you're eating. So what GERD is when this muscle, this sphincter, is either opening inappropriately or weak. And so the gateway that's keeping all that acid inside is not working correctly. And so the stuff, including the acid, the digestive enzymes, the sometimes particles of food are coming back up. And that's called reflux. So to break down the GERD's the word, is the gastroesophageal, which is the stomach esophagus, reflux, which is when things go back up, and then the D is for disease. And that's to have gastroesophageal reflux is not actually that abnormal. Again, it can be part of a physiological process, but when it starts to cause a lot of symptoms or damage, then we call it, then you get the D at the end, GERD. And what else? If you have, everyone's going to have, I don't think there's a person in the world, if you have a stomach and you have an esophagus, at some point you've had the sensation of heartburn. That's not unusual. But if you're having symptoms more than 2 times a week, or if the symptoms are moderate to severe once a week, then you get the medical diagnosis of GERD. So that's the definition. The symptoms actually can be pretty variable. A lot, we're most familiar with heartburn, which can be a burning sensation in the top of the stomach or in the chest. The actual sensation of regurgitation, when you can have things kind of come up into the back of the throat or even expel it. Increased gas, belching, bloating, sensitivity to certain foods. And then there are actually some less common symptoms that can happen when it's either gone on a long time or you can have what's called silent GERD, which is when things are coming up and you don't necessarily feel it. You just have these sort of vague symptoms like chronic hoarseness or bad breath or a chronic sore throat, a cough that's not going away, even dental erosions on the back of the teeth or gum disease. That can be from this persistent reflux of the caustic material coming up into the throat or the back of the mouth. So not everybody has the classic symptoms, and so they don't necessarily know that something's going on. There are some things that can put you at risk for having this issue. So things that relax the lower esophageal sphincters. There are certain foods and chemicals like caffeine, chocolate, alcohol, peppermint, smoking, certain hormones like those in pregnancy, or the menstrual cycle can affect this sphincter. So anything that causes it to relax can contribute to or make you at risk for GERD. And then certain foods, mostly because they either increase the acidity of the stomach, or once they're refluxed, they're really irritating, like tomatoes, citrus, other acidic fruits, very spicy foods. And something that was surprising to me that I didn't actually know until I was doing a lot of research for this presentation was that foods with high fat content. We normally think of high fat content foods as bothering the gallbladder, which is a separate issue, but it actually can increase the acidity in the stomach and cause the same kind of problems as, what we usually associate with GERD, which is like, tomato sauce and spicy Mexican food, that kind of stuff. Other risk factors or contributing factors, overeating. So anything that increases the intra-abdominal pressure. So anything that's increasing the pressure in your belly and kind of pushing on the chest, like overeating, being pregnant, being overweight, especially that truncal obesity where your stomach is where you carry most of your weight, being in a position like lying flat, or if you're in a job where you're, for some reason upside down, they have problems with this. Drinking a lot of carbonated beverages because it puts a lot of pressure up onto that sphincter, or tight clothing that you wear around the chest or the upper abdomen. Those things can increase the risk of having this stuff reflux. And then I know that you guys are going to talk about this later, so I'm just going to mention it. Having something called a hiatal hernia, which can be kind of hard to visualize. So if you look at the PowerPoint, it's a little bit helpful. But the diaphragm is this muscle that helps us breathe, and it basically creates two compartments. You got your chest and your abdomen, and the diaphragm has a very small hole, and that's where the esophagus is supposed to go through, and it sort of keeps the abdominal organs down below. When the diaphragm hole is too wide or is too loose, the stomach can actually pooch up above the diaphragm, and that's what's called a hiatal hernia. And so people who've been diagnosed with that, it's hard to visualize. Sometimes it's called a sliding hiatal hernia because it can actually go up and down. But when you have this condition, the lower esophageal sphincter it's not going to be able to do its job because anatomically it's not sitting where it's supposed to. Part of the stomach is up above, the thing that's supposed to keep it down. So the presence of the hiatal hernia is in itself going to put you at a high risk of GERD. The way that we diagnose this clinically, it's usually diagnosed clinically. So it's based on your symptoms. Are you having any of the symptoms we talked about? Heartburn, reflux, that water brash taste in the back of the mouth. Generally speaking, for most people, we don't need to do any special testing to diagnose. It's based on your symptoms, and then ultimately it's based on how you respond to treatment. If you're responding to treatment, then most likely the symptoms are GERD. If there's a question about what's going on, we can do something called an upper GI esophagram. You drink some contrast. We take a bunch of x-rays and see how the esophagus looks on an x-ray. Or you can get an esophago-gastro duodenoscopy, which everyone calls an EGD, or an upper endoscopy. And that is when it's a more invasive exam. You go to sleep and the doctor takes a camera on a long tube down your throat, into the esophagus, into the stomach, takes a look around, may take some biopsies if they see something that looks worrisome. And so if we have questions, or if a patient has what we call red flag symptoms, such as weight loss, difficulty swallowing, vomiting with blood. If they're above a certain age or they have a family history of esophagus problems, that might prompt us to do a little bit more investigation. If someone has been on treatment for GERD and they're not improving, that would be another reason that we would want to take a look and do a direct visualization of that area. And then finally, if the gold standard, or one of the best ways for us to determine if someone's having GERD and if they're responding to treatment, is something called the esophageal 24-hour pH monitoring. And chemistry class a long time ago, pH is how we tell how acidic something is. And you wear this thing, it's like a spaghetti, a piece of spaghetti that goes down your nose, into your throat, down into your stomach, and then connects to something that you're wearing on your pocket. And it tells us how acidic things are in your esophagus. And you can document your symptoms, and it'll tell us, yes, they were having reflux at that time. So it's a really helpful tool. But again, that would be for people who have failed treatment. You know, you've sort of advanced from treating yourself over the counter to seeing your primary care doctor to seeing a gastroenterologist, and that's when those sort of tests are run. And one of the points that I want to make is that if this is left untreated, there are potential complications, and I call those the GERD, the bad, and the ugly. So if you don't treat this, if you sort of grin and bear it and just accept that, I'm just going to have heartburn for my whole life, there can be problems. So it is something that you want to address, something that you want to either try to treat yourself or change, do some of the things we're going to talk about treatment wise, but you don't want to just sit on it. And I will briefly go over those. You can get something called erosive esophagitis, which is when the esophagus actually starts to break down because of the exposure to acid over and over again. Esophageal ulcers, which is basically the next step from that, where you're actually getting deep holes almost in the esophagus, and those can bleed. Esophageal strictures, which is when you have scar tissue formed from the repeated acid backup that creates a tight area, and then you can't swallow. So things get stuck, and then you have to have procedures to go in and open it up. You can develop something called Barrett's esophagus, which is when there's cellular changes in the esophagus from the repeated exposure, and that is actually a precancerous condition. You can develop chronic cough or laryngitis, like we talked about before. And then one of the more serious, less common things is you can get aspiration. So the reflux contents come up, and then they go down the wrong tube. They go into the larynx, and then into the lungs, and then you can end up with pneumonia. So those are sort of the things where we've let it go on too long, or it's just really severe, that can happen. And so the management. So the first things that we can do that are, they have no side effects, and we don't have to worry about, it's the best way to start are with some lifestyle changes. So things that, and it's not going to be the same for everyone, because not everyone is going to have the same foods affect them, or the same, it's going to be different, but these are some general guidelines. So eating smaller meals, avoiding overeating to help keep the abdominal pressure down, staying upright after eating for at least 2 to 3 hours, avoiding late night snacks. And this is all related to gravity. So gravity helps the digestive tract. It's, our digestive tract is amazing, and it can do things even if we're completely upside down, but gravity helps. And whenever it's working against gravity, it's working harder. So staying upright after you eat, don't eat late at night, maintaining a healthy weight. So trying to avoid that excess weight around the midsection can help, especially if you've gained weight and now you're having symptoms. Those are the kind of people that usually benefit the most from weight loss. Sleeping with the head of your bed elevated, which does not mean cranking yourself up on pillows, because then that actually pushes down onto the abdomen and can cause even more reflux. So you actually have to lift the head of the bed, not by much, 6 to 8 inches. So you can use bricks or wood blocks to actually raise the bed, or you can do a foam wedge under the mattress. But those are some of the ways that you sort of let gravity help you. And this is especially important for people who have a lot of nighttime symptoms. So some people are fine during the day, and then the minute they try to go to bed, that's when they start to have these symptoms. So those people benefit the most from these, the head of the bed raising, and then minimizing dietary triggers. So those foods that we talked about, and I'm going to have some links at the end of that PowerPoint that go over some GERD diets and some general rules of thumb, some foods that can help, but avoiding alcohol, smoking, and then the other foods that we talked about. And like I said, not everyone's the same. So some people are going to be really sensitive to certain things. Like when I have heartburn, it tends to come from things that I wouldn't normally expect, like Pop-Tarts. So I just don't eat Pop-Tarts anymore. Avoid other things you can do, avoid tight-fitting clothing around the midsection or lower chest, don't smoke, and don't be pregnant, if you can handle that. And these things might not be forever. They, sometimes there's just a period of sensitivity. So if you can make these changes, people are very upset. They're like, so I can't have coffee ever again? No, sometimes you just need some time away from coffee, or you need to minimize coffee, but allowing your esophagus some time to heal is sometimes all it takes. And then slow introduction of those trigger foods. Things that you can do medication-wise, and I'll just go through these really quickly. Most GERD treatments are available over the counter. So they're things that are quick, easy access for you, but they can be confusing because there's an entire aisle of them. So some categories: antacids. These are things like Rolaids, Tums, Gaviscon, Maalox, Mylanta. These are acid neutralizers. And the benefit of these is that they work in 5 to 10 minutes. So you're going to get some instant relief. The bad part about them is that they really only last about 30 to 60 minutes. Sometimes that's enough. That was enough to neutralize that acid, the stomach empties, and then you don't have that, you don't have the symptoms anymore. If you take them frequently over a period of time, you can develop rebound acid. So you neutralize the acid, and then the stomach says, oh my God, and it increases the acid again. So you can, it's not something that you want to do over and over again every single day. There are minimal side effects, although I will note that you can take too many. I have patients that come in and they say, oh, I'm taking Tums like candy. And you can actually poison yourself. Like, you can end up with what's called hypercalcemia, which is when your calcium levels are out of off the charts, and then you can develop heart arrhythmias. So a message that I would get across is that you should follow the instructions on the bottle and only take what's recommended. The other thing is, if you're taking that much, it's either not working or there's something else going on. So that's sort of the first line. There's also something called sodium alginate, which creates a sort of a layer on top of the acid to help it from coming up. That is also available over the counter, like in Gaviscon. And then there are histamine 2 receptor blockers. So these are things like Pepcid and Tagamet. We used to have Zantac, but it got pulled from the market. These are the next line agents. They are available over the counter. You can also get a prescription for them. They used to be prescription only. These work not as quickly as antacids, but faster than the last category. So these work in about 60 minutes. They can last about 12 hours. They can be taken on a daily basis if needed for, usually we say, a couple of weeks. If that's not working, then you should really see someone. The final category is proton pump inhibitors. So these are things like Nexium, Prilosec, Prevacid. There's a bunch more that are prescription only, but those are the ones over the counter. And these you would not take for instant relief. They can take 1 to 4 days before you're going to really see any improvement. So what we would usually recommend is use antacids until these things sort of help. And these are not things that you take, every once in a while when you're having heartburn. They're when you're having real problems and you expect to be on the treatment for at least 2 weeks. And again, they're available over the counter and there's prescriptions. We're finding more and more that there are side effects that can be significant, especially with long-term use. So we've gotten a lot better about deciding how long someone should be on treatment. And that's something that you would discuss with your doctor. But I would just say, if you're going to take them over the counter, give yourself a 2-week period and then stop them. If the symptoms come back, you should see your doctor. There are some natural alternative options. If you're not someone who wants to take a lot of medications, and I know BioTouch is going to talk to you about some, non-medicinal treatments, which I think are fantastic, because again, this is something that we're either going to experience periodically throughout our life or may have episodes that last several days. And so having, not having to take a medication for it can be, the more, you're not going to have side effects from them. Okay. And then things that are that you take orally that are non-prescription or over-the-counter medicines, you can do sodium bicarbonate, which is baking soda and water. You can do low-fat or non-fat milk or yogurt. The high-fat milk can actually increase acid, so stay away from that. Ginger, aloe vera, and then probiotics are generally helpful for the digestive tract. There are also surgeries, and again, that's something that's way past what you can do at home. So that's something you would talk about with a gastroenterologist, and I won't bore you with that stuff. But for example, a hiatal hernia, if it's really causing a lot of problems, there's a surgery that you can do to repair that. So that's it.
Somebody somebody was asking us when you talked about the acidic part of it. She goes, I heard a teaspoon of mustard daily helps reduce stomach acid and lessens the reflux episode. Is this true? Have you heard of that?
Of what kind?
Mustard daily.
So that would surprise me because mustard is acidic. I've heard the same thing about apple cider vinegar, and I don't understand the mechanism because generally these are acidic. So I think the idea is that if you take them with a meal, they can help to break down what you're eating beforehand. But when it comes to preventing, it would surprise me if that, and I'm sure it's not clinically studied. It would be more anecdotal. Okay. And again, if it works for you.
Right. That's what you said. So somebody else wanted to know, is chronic inflammation a cause for GERD?
It can be. So they used to think a lot more that that stress, like being stressed and being chronically stressed would lead to increased acid production in the stomach. And I think there's something to that. I also think that the autonomic nervous, the brain and the gut are very closely related. And I would say that GERD is itself a chronic inflammatory condition. And a lot of the medications they use for chronic inflammatory issues can cause GERD, can contribute to GERD or to acid indigestion.
Okay. And then one last question we had, somebody wanted to know, can you talk about laryngeal reflux? Is that a type of GERD or a different disorder?
So it's a good question. It is, I think it can be its own separate thing, but it can also be a complication of GERD. So it's when, like we talked about, when the acid comes all the way up into the throat, then you can start to get vocal cord inflammation. You can get sore throats, a chronic cough. In fact, GERD is one of the most common causes of a chronic cough that is often undiagnosed.
Wow. Suzanne, you are awesome, man. I'm just like spinning.
I'm kind of a nerd for GERD.
Nerd for GERD, and we're glad you are, because that was a lot of good information. And for all of you out there, we've got her PowerPoint will be part of the email that will be sent to you with a replay of this. If you're not on the email list, send us an email at office@justtouch.com and we'll get you on the email list. Suzanne, thank you. Eileen, good find.
Thank you,
All right, you guys
Suzanne.
have a good night.
Okay, thanks. We'll see you soon.
Sounds good. Bye.
Wow. So I was visualizing the old movies with the guy who was under so much stress, smoking a cigarette at the same time he's drinking coffee, and then he has the bottle of Maalox there, and
Right.
Oh, so I do remember that they used to associate heartburn and reflux and everything with just being a high stressed individual.
Yeah. Well, that was great. I'll tell you, there's a lot of good stuff in here, and I think as we're going to go over how to address GERD and hiatal hernia with BioTouch, it all fits right in there, you know. And as we share how to do the points, Eileen is going to be our master teacher. I'm going to be our master techer. And techer, oh, that's a dangerous word. So hang out with us. We're going to share with you how to do BioTouch. Go to justtouch.com/workbook for the next month, and you can download our little workbook. And Eileen is going to take us through it. We're going to teach you just 3 sets of points and talk a little more about GERD. If you have any more questions, just type them in there, and we'll answer them as we go along. Take it away.
All righty. Well, I guess I am a little disappointed that my future plans of being an acrobat in the circus is out, since I have problems with gravity and heartburn anyways. So I'm not going to be hanging upside down for a while, I guess. So our workbooks. So our workbook, for some reason, I don't have it on my screen. So our workbook, the first page, is written up by our scribe and fellow board member, Paula Taylor. And Paula writes this first page up for us where she, excuse me one second. I had to find my mouse there so I could find my screen. I apologize, everyone. There we go. So our first page is written up by our scribe, Paula Taylor. It's got this great synopsis to review really quick again, what Suzanne had just told us about with GERD, what it is, the symptoms and how it's treated in general. And at the bottom of this first page, we have our contact information and our mission and our vision statement. I just want to read really quick. Our mission is to teach BioTouch as a unique natural approach to alleviate pain and stress and support good health through all stages of life. So that's why we're here tonight. And we're here to teach you how to do this so you can help yourself and also all your friends and family and other loved ones with reflux, because we know it can be pretty painful and scary sometimes. So on our first page, or excuse me, the second page, we're just describing what is BioTouch. So BioTouch is just a simple hands-on healing touch technique that can be used to address any type of health concern, okay? All it takes is these first 2 fingers of each hand and 2 people. So BioTouch is a relationship. It's a relationship between 2 people and using 2 fingers. So anyone with these 2 hands and these 2 fingers can perform BioTouch. It's easy to learn. Children can even learn this. I even taught my twin 4-year-old nephews how to do BioTouch on each other. And everyone who learns it is effective. They're effective their very first time they try it. It doesn't matter if you've taken all our classes and you've been doing this for 20 years, or if you're just following along right now trying to do this on someone, you are going to be effective, okay? And BioTouch is a complement to any healthcare program. So it can be used with the medications that Suzanne was just talking about. It can be used with the diet changes and your lifestyle changes. And it can even help you to make those diet and lifestyle changes, because another beautiful thing about BioTouch is self-awareness. It'll help you to become more aware of what is triggering your reflux. Was it that food? Was it the stress? Was it the position you're sleeping in? What changes do you need to make? BioTouch is going to help you to find that, okay? And another neat thing about BioTouch is it requires no special preparation and no special belief system or a special state of mind to practice. So you could be driving home from your fancy date and your date has reflux there in the car. Well, you could do BioTouch right there in the car and get it taken care of. So now you can go off to make out point and finish your date. Don't know where that came from. Or BioTouch could be done in the doctor's office. BioTouch could be done on a bus, on a plane, on the beach. Heck, I'm even notorious for doing BioTouch by the poolside whenever I see someone suffering for any reason. And so it could, again, anyone can do it. It can be done anywhere, and there's no special preparation. So how do we do BioTouch? Well, it's very simple. You're going to wash your hands before you touch. This is going to be done on the skin using a butterfly-like light touch. So that's why you see that butterfly logo on our pages and on our website and everything. It's a butterfly-like light touch. So don't dent that skin, just barely touch it, okay? And again, it's one person touching another. And you're going to touch all these points that we're going to show you for 6 to 8 seconds. Okay, so that's a big key. Now, moving on to our next page, we have the terms used in the manual. This is a language we've developed for you to just to understand how we apply these points. I'm not going to go over this right now, but this is something for you to read. Again, just to explain how we apply the touch. Our next page is the first set we're going to do tonight, and that's the greeting. The greeting is the key to turning BioTouch on. If you could imagine the car, you can get in that car, you can play with the steering wheel and hit all the pedals and buttons like crazy, but that car is not going to drive anywhere until you turn that key and get the ignition on. And so with BioTouch, the greeting is the key to start it. And you'll see on these diagrams, the way we have this set up is on our first page of each set, we have this drawing that has numbered points on there. And those are just to show you where you're going to be touching and in what order. So it's a very easy description. Our second page will have photographs, actual images of an associate performing this on a recipient, so you can get an idea of where it is on a real body. But most of all, on that second page is the in-depth description of how exactly to find those points. And that's another neat thing about BioTouch. When I said anyone can learn this, even my nephews, it requires no medical terminology. So just read those words and you will be able to find those points easy peasy.
And those words are going to be exactly the same words as the video, which there's a link on each of these pages. And so let's show you the greeting set.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds.
Alrighty, so after you perform the greeting, the next set in our workbook is the stress, anxiety, and shingles set. Because as we were talking, stress can be a big trigger for this. So the stress set can be used to address not only the stress associated with, reflux, but all the mental and the physical and emotional manifestations of stress and anxiety. Now we're going to watch this video.
The stress set may be used to address any manifestation of physical, emotional, or mental stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
That stress set is so powerful. In fact, I had my husband perform that on me just a few minutes before I came on this evening. I could hear my heart pounding in my ears before, and now I feel fine. So our next set is the metabolism set. So the metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. In this case, I like to think of the metabolism set as being our inflammation set. So we want to eliminate all that inflammation and everything that's got the GI tract swollen and irritated. But also this can be used, like I said, to assimilate and eliminate. So we're going to help to eliminate all that extra acid and just get the body move in the direction we want it to move. And so we have another wonderful video here for that.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle.
So I want to...
Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
So I want to point out how effective this metabolism set is. It's actually so effective that we like to have people work closely with their doctors when they are taking medications, because it can change their need for these medications. They might need to lower their doses. And so, especially those of you who are using insulin or other blood sugar lowering medications, be sure to work with your doctor. So our next set, now we're getting really into the symptoms now of reflux and hernias. And this is the upper abdomen set. So this set can be used not only for reflux and heartburn, but anything that affects the stomach or any of those organs in the upper abdomen.
The upper abdomen set may be used to address conditions related to the organs that are located between the bottom of the breastbone and the navel. These organs may include the stomach, liver, spleen, kidneys, intestines, or gallbladder. Generally, the procedure is performed while the recipient is lying on their back. The upper abdomen has 4 steps. Step 1. With one hand, hold at X, which is in the fleshy area just below the bottom of the breastbone. This is the same as greeting point 1. With the other hand, touch points 1 through 5. Point 1 is in the soft tissue just inside the ribs, where the ribs begin to curve outward. Point 2 is the same point on the opposite side of the body. Point 3 is in the soft tissue just inside the ribs, where the ribs begin to curve to the side. Point 4 is the same point on the opposite side. Point 5 is just above the navel. Step 2. With the palm open and flat, slide the entire hand under the recipient's body and place the first 2 fingers of this hand on the spine in contact with the breakover point. Remember, the breakover point is directly through the body from greeting point 1. Then, with the hand underneath the recipient and the fingers in contact with the spine, touch points 1 through 5 and X with the other hand. Point 1 is in the soft tissue just inside the ribs, where the ribs begin to curve outward. Point 2 is the same point on the opposite side of the body. Point 3 is in the soft tissue just inside the ribs, where the ribs begin to curve to the side. Point 4 is the same on the opposite side. Point 5 is just above the navel. And X, which is in the fleshy area just below the bottom of the breastbone. After completing this step, enhancements in local work may be performed as needed. For example, an associate could sweep across or around any scars.
It's also a good time you can come down the esophagus into the stomach.
Step 3. In through fire, touch points 6 and 6, which are on each side of the body, even with a line running slightly above the navel. Then touch points 7 and 7, which are on each side of the body, on a line running slightly below hold point X. And finally, in step 4, perform a matching fire and touch points 1 and 2, points 3 and 4, and points X and 5.
Wowee! There we have it. Good job, Eileen.
Powerful stuff.
Powerful stuff.
Seems too simple, but it works.
It's incredible how it works. And so again, just if you didn't hear me, when your hand is underneath that body, you can sweep down that esophagus, as Suzanne was telling us, into that where the sphincter muscle is there. And you can go down or up, across, to get that to relax, to get that to stop the acid from coming up. I mean, and you can do biotouch. It doesn't have to be done laying down. So when she said laying down sometimes isn't a good position, you could do that stomach set sitting up in a chair. You know?
Absolutely.
Yeah, and just get all of that to just relax and calm down. So, and you know, it could be your go-to. You know, instead of the Tums, try something like biotouch. It can't hurt. I mean, she said it's just. And give it a couple of weeks. You know, don't just assume, oh, one time it's going to be, but see what happens when you do it while you're having the attack, and then do it another time in there to get the body to start, like you said, the metabolism set can help the body start breaking down these acids and get the whole metabolic process to work correctly. And I've known a lot of people who've done biotouch for hiatal hernias and GERD issues.
And it can be done so quickly. You can be doing this while you're waiting for your Tums to kick in or for your Maalox to kick in. You can be doing biotouch to help it work even faster and better. What the heck? It's worth it. I know.
It's worth it.
Reflux is painful. Try it. It's not going to hurt.
And another
thing, only help.
It's all you have to do is the greeting, and then you can add or subtract. You might just do the stress for a couple days, or you might just go right to the local work because you're having an attack at that moment. So you can mix and match these things. We just gave you some of the basics, but you might do one of those sets only, or just the stress set just to relax yourself. So if you have any questions, you always can contact us, justtouch.com. You got our phone number up here. You've got our email up here. We're here to help you, you know. And if you're up there in the Dove Mountain area, go see Eileen. Go see Eileen. She has biotouch in Dove Mountain. We're here at Tucson, Arizona, but we have classes to teach the whole technique, and we are available for consultation, for talking to you. We'll even tell you a few jokes if you want.
No guarantee on them being good, though.
Yeah, right. So next month, what do we have? TBIs, traumatic brain injury, and CBT. We have another.
Dr. Katie Henry.
Oh, we're looking forward to that. That's getting to be a big problem, and this will be a great workshop next month. It's the fourth Thursday of the month, so that will be, what do we have there? 9/28, September 28th, and. Eileen, thanks. That was fun. You were great.
Thank you. Thank you, Suzanne.
Thank you, Suzanne. And thank you all for joining us this evening. We'll see you next month. Bye-bye.